Perhaps the most feared of the cardiovascular problems is stroke. I've talked to so many patients over the years that don't really fear much in terms of their health except for stroke. No one wants a stroke. No one wants to survive a stroke. They'd almost rather die than be left with the aftermath. And almost everyone knows someone or some family member or some friend of the family who's had a stroke. So it's a very tangible problem. You know, the good news is that with proper screening, with proper attention, and with proper care, stroke is preventable. And certainly if it occurs, stroke is treatable. There are many different avenues to this, but again, it boils down to, first and foremost, managing those things that can be managed. Not smoking, proper diet, proper exercise, control of blood pressure, cholesterol, and blood sugar. Individuals, men of 65 years of age and older, women in the same age range, ought to be seen and have a complete history and physical performed on an annual basis. Individuals that have multiple risk factors, like the ones I mentioned previously, ought to be considered for screening. And the screening is very simple. For stroke, there are a couple things that tend to really cause most of the problems. One is blocked arteries in the neck, the carotid arteries in particular. About 50 to 60% of the strokes that occur on an annual basis are because of clogged arteries in the neck. The same blockages that cause trouble in the heart, that cause heart attacks with the heart, cause strokes or brain attacks. A simple ultrasound test is all that's necessary to do adequate screening, and the treatment nowadays is much simpler, much less invasive. Routinely at El Camino, we perform carotid stenting as opposed to conventional carotid surgery as a less invasive way of achieving the same result of an open artery and prevention of stroke going forward. There are other subgroups like patients with atrial fibrillation that are important to consider as well. Proper medical therapy is certainly important, but more and more we're treating these patients with more definitive therapies like ablation, where we actually go in and short-circuit the cause of the heart rhythm that causes the ultimate stroke. So it's another area where we can really make inroads here. And then there are a group of people that don't necessarily fit the usual categories. These are sometimes patients who are younger, who have stroke for no apparent reason. Sometimes we find in these folks, again with simple screening, which is an ultrasound of the heart, an echocardiogram, that they may have an inborn abnormality of the heart that they have never known about the entirety of their adult life, and yet they now have susceptibility to a stroke because a blood clot can pass through a hole in the heart. This has become more and more in the public eye as people that we see in the press have kind of come out and said, yes, I had this problem, it was easy to fix. These are problems that formerly all required significant open surgical approaches, but nowadays stroke is preventable and it's treatable, and it's really not something that someone needs to suffer unless they simply stick their head in the sand and don't pay attention to warning signs. Increasingly in America, we find that there's another cardiovascular problem that we really need to pay attention to, and that's aneurysms. Many of you have heard about that. The aneurysm is basically an abnormal enlargement of a blood vessel. And the one that gets the most attention, and appropriately so, is when the aorta is involved. The aorta being the largest body the aorta being the largest artery in the body. It runs right out of the top of the heart and gives rise to all the major branches of the body. In the chest, the thoracic aorta, and in the abdomen, the abdominal aorta, are two areas where when aneurysm occurs, it can have a high fatality rate. People who have large aneurysms in that location are prone to rupture. When those aneurysms rupture, 80% of patients die before they get to the hospital. Of those 20% that make it to the hospital, another 80% die in the hospital. So being in the business of trying to treat aneurysms, the last thing anyone wants to do is have to treat it when it's rupturing. Not that it can't be done, and not that we're not making inroads and doing that in a better, more efficient way. But when people are diagnosed with an aneurysm, it needs to be followed up on. Now, the diagnosis of aneurysm is pretty simple. It's an ultrasound test, which is a sound wave test that can be done in any physician's office or hospital in America. Patients at risk for aneurysm are patients that have ever smoked, patients with high blood pressure, or patients with a family history of aneurysm. They do tend to run in families. Once an aneurysm meets a certain size or a certain diameter, then treatment is usually recommended because it's much easier to treat when it's elective rather than when it's an emergency. Treatment nowadays is, again, much less invasive. We routinely treat these problems with something similar to what we do in the heart, a stent. Because the aorta is a much larger artery, it's a much larger stent, mind you, and it's a stent that's covered with something like Gore-Tex. It's a fabric that channels the blood flow through the graft so that it no longer communicates with the weakened blood vessel wall. Folks that are treated here at El Camino Hospital for this problem using these stent grafts oftentimes have their treatment performed with nothing more than a puncture in either groin. They oftentimes will go home the next day, and this is a dramatic improvement from an open surgical procedure that otherwise leaves a patient in the hospital for a week with several weeks of recovery thereafter. So if you have an aneurysm, if you think you have an aneurysm, or at your risk for an aneurysm, get screened, get diagnosed, and learn your options.